Good day, everyone. Our group is now presenting the electromagnetic physical agent modalities. So before we start, we are just going to discuss briefly what are the electromagnetic PAMS. These are the ones that uses electricity and electromagnetic spectrum to facilitate tissue healing, improve muscle strength and endurance, and decrease edema, modulate pain, decrease the inflammatory process, and modify the healing process. So our group is going to have four electromagnetic agents that are going to be discussed.
Okay, for the first electromagnetic modality we will discuss is the neuromuscular electrical stimulation, or NMES. It is a device that sends electrical impulses to the nerves, and this input causes muscles to contract. The electrical stimulation can increase strength and range of motion and offset the effects of disuse. For the rationale of NMES, it is often used to retrain or re-educate a muscle to function and to build strength after a surgery or period of disuse. It emits a stronger and wider electrical pulse, and this pulse stimulates targeted muscles to contract repeatedly over a specific period of time. And then for the placement of NMES, the electrodes should be at least 2 inches apart so that they will not be too close or less than an inch apart. When the muscle contracts, to produce a muscle contraction, place one electrode over the motor point for the muscle and the other on the muscle to be stimulated. And then for the treatment duration, it depends. So for muscle strengthening, it is generally recommended that treatment that lasts long enough to allow for 10 to 20 contractions. This will usually take about 10 minutes. Then for muscle reeducation, it is no longer than 20 minutes at a single session, less if a patient shows signs of inattentiveness or fatigue. And then for the frequency, smooth tetanic contractions are achieved with a pulse rates greater than 35 to 50 pulses per second. Pulse rates will differ depending on the goal of the treatment. Higher frequencies influence sensor perception and level of muscle fatigue. The clinician should select the lowest frequency that achieves the desired result. And for the amplitude, pulse amplitude is gradually increased within the patient's sensory tolerance limit. So for precautions of NMES, persons with cognition or communication impairments, sufficient to prevent them from giving accurate and timely feedback. And then areas of impaired sensation that prevent accurate and timely feedback also. For indication, it is muscle atrophy, muscle weakness, peripheral neuropathy, and muscle spasm. It is contraindicated anywhere on pregnant women, presence of cardiac pacemaker, presence of cancer due to risk for metastasis, obesity, impaired sensation over relatively superficial metal implants, and any area unstable due to recent surgery, bone fracture, or osteoporosis. So these are examples of NMES. So NMES is used in conjunction with active exercise. So this is an example of an MES.
Hello, so I will be discussing about functional electrical stimulation, or FES. So FES is a subtype of NMES in which the stimulation assists functional and purposeful movements. So this is achieved by applying electrical stimulation to muscles that when they contact produce a movement that can be used functionally. So FES is usually used for muscles with MMT grade of 2 to 3 minus. So if muscle is can tolerate movement against gravity, we cannot be electromagnetic pumps is not used anymore. So FES allows muscles that have been paralyzed or partially paralyzed to function again. So electrodes are usually placed on the muscle belly of the muscles being addressed, and If you are using FES as neuroprosthesis, it is usually worn on the wrist, thighs, legs, and trunk for parastep system. And the treatment duration is usually 30 to 45 minutes while actively trying to perform a functional task. The minimum frequency required to induce fairly consistent contractions is between 16 to 20 hertz. So pulse frequencies in the range from 20 to 50 hertz are typical. So for example, for patients with SCI who often have problems with FES-induced muscle fatigue, and particularly during early stages of FES use, pulse frequencies of 20 to 25 hertz are more common. So in patients with stroke, for whom FES-induced muscle fatigue is not a common issue, we use a pulse frequency of 40 to 45 hertz. The amplitude needs to be high enough to evoke the desired effect while still remaining comfortable. So therapy should apply the FES with caution on patients that uses electrical control devices such as baclofen pumps, deep brain stimulators, or indwelling pain control devices. It is also needs to be used in caution with patients with morbid obesity, severe sensory deficit, and chronic infectious disease, as well as neurogenic pain syndrome, inappropriate response to stimulation, and chronic skin conditions or poor skin integrity in the area of stimulation. It is well indicated for patients who have central nervous system injuries or disorders, for example, for stroke patients, multiple sclerosis, incomplete SCI, since patients needs an intact sensory system while using the electromagnetic PAMS, cerebral palsy, traumatic brain injury, hereditary spastic paraparesis. FES is contraindicated for patients who have lower motor neuron lesions, pacemakers, seizures, since it can induce a seizure episode, pregnancy, malignant tumors in the area of stimulation, blood clot in the area of stimulation. Though, however, insufficient evidence exists to confirm or deny that FES is contraindicated in these circumstances, medical clearance from a physician is necessary for considering the use of SES with these conditions. So this is a picture of a FES we usually see in the clinic. So the electrodes are placed on the muscle bellies of these patients. This is an example of a neuroprosthesis worn on the wrist and hand. So the patient is wearing this FES as he grips and release an object. And this is an example of a parastep system when patient wears the FES on the trunk as an aid for the patient to stand using the mobile walker.
Hello again, everybody. So, what is TENS? TENS means transcutaneous electrical nerve stimulation and is applied to help stimulate sensory or motor nerves to help manage the pain. How is it important? Especially in our OT part. So, TENS is very effective in helping manage pain through the application of the gate control theory of pain. So, once TENS is applied, it will allow our patients to perform more of their activities, like their normal activities, though the patient may need to be instructed to avoid potentially symptom aggravating activities. So where should this be placed? The most common placement in a tent is where the painful area is. But sometimes when the electrodes cannot be placed near over the painful area, an example of that is if there was a cast or a local application of electrodes is not tolerated, what we can do is that the electrodes can be placed in a proximal to the site of pain along the pathway of the sensory nerves that are supplying to that area. So if you're wondering, the treatment duration for this is just between 20 to 30 minutes and not more than that. Frequency of that. So we got the three types of TENS. So we got the low rate TENS, the high rate TENS, and the burst mode. So for the low rate TENS, Low rate TENS comes with just 2 to 10 pulse per second. High rate TENS comes with 100 to 150 pulse per second. And the burst mode, they are generally presented in our unit. So the unit that we use, the little machine that we use at 10 bursts. Amplitude also got the low rate TENS for visible. So when we see a visible contraction, then that is the highest we can do. For the high rate TENS, if the patient can have a feeling of tingling sensation or it can produce tingling. And for burst mode, there's supposed to be also a visible contraction. Precautions. We should always be careful using TENS when somebody has a cardiac disease, when a patient has an impaired mentation, it's mental. And next is impaired sensation, and also malignant tumors. So the areas of skin irritation or open wounds contractions, low rate TENS may cause delayed onset on muscle soreness too. So indications, we can use TENS for low back pain, can use it for reflex sympathetic dystrophy conditions, spinal radiculopathy, or chronic pain syndromes, and more. So what we should not do when applying TENS. TENS should not be applied to areas that have impaired sensory awareness. Also, we should not do it with persons with cognition or communication impairments that are sufficient for them to prevent them from giving accurate and timely feedback. No placement of electrodes over our carotid sinus areas, also areas where venous or arterial thrombosis or thrombophlebitis is present. Lastly, it should also not be over a pregnancy, especially over or around the abdomen. Electric stimulation may be used, but it needs doctor's permission too. So these are some of the examples of TENS. I'm pretty sure we are all familiar of TENS. It's one of the most common things that we have to use. So as you can see from the first picture, he's using the TENS over the head. We don't see any functional things to do as TENS is a preparatory to help manage the pain first, and then they can do their activities. So that is a TENS over the hand.
All right, lastly, I will be talking about iontophoresis. So iontophoresis is originally referred to as ion transfer. It involves the introduction of ions into the body tissues by means of a direct electrical current. So basically, it's transporting chemicals or medication across the skin membrane, which uses electricity or electrical force as a driving, electrical current as a driving force. So the reason why some therapists use this agent is because it is a painless, sterile, non-invasive technique. So this is the placement on the picture. As you can see, the cathode or the negatively charged patch is placed on top of the area where there is pain or where the symptoms are. And then the anode or the positively charged patch is placed in a more distal part. And also it's important to make sure that the skin should be shaved and cleaned prior to putting the electrodes. Treatment duration will last between 10 to 20 minutes. Frequency is not applicable for this agent. And then for the amplitude, it is between 3 to 5 milliamps. And also you can set it up to patient tolerance. Precaution. So the therapist should have a good understanding first of the existing condition to be treated in order to place the correct patches on the right muscle areas. And also therapists should use the most appropriate ions to accomplish the treatment goal. So the medication charge should match the patch or should match the area to be placed on. And then the therapist should also use appropriate treatment parameters and equipment setup. So this agent is indicated for patients who experience inflammation, algesia or pain, muscle spasm, ischemia, edema, and many more. It is contraindicated to patients who have skin sensitivity reactions or certain allergies to materials or certain chemicals. sensitivity to aspirin, patients with gastritis or active stomach ulcer, those who have asthma, sensitivity to metals, and those who are sensitive to seafood because they contain iodine. On the upper left hand picture, you see that is the dispersive or the inactive patch, which will be placed in a more distal area or part of the pain. And then on the lower right, that is the medication patch foam, wherein there the therapist will put the medication. Upper left is a sample of a medication for the patient. And on the lower right picture, you will see that since the medication is in a liquid form, we will use a syringe to apply the medication on the patch. And that is the placement. And then on the lower right picture, you will see the parameters. And these are our references.